Hi, welcome to our weekly healthcare show. I'm Max Macaluso, and joining me today is David Williamson.
Hi, everyone.
So, David, up ahead, we have serpentine receptors, we have a cutting-edge depression drug.
And a stock investors need to watch.
Right. First, let's tackle our headlines of the week.
Absolutely.
First one is the Supreme Court ruling on gene patents.
Well, that's right, Max. Everyone is focused on the Supreme Court regarding their decision over gay marriage, but there's actually another landmark case brewing in their halls. They just heard opening arguments whether companies can patent human genes. Now, Myriad Genetics is the right to two genes that increase the risk for breast and ovarian cancer, and they sell the only test for these. They have the exclusive test for it. Now, opponents argue that this limits innovation, and I think there's sort of an interesting baseball bat analogy that came up. Myriad Genetics lawyers said that, you can't patent a tree, obviously, but you can, cut it down and turn it into a baseball bat, and you can patent that. Chief Justice John Roberts seemed a little skeptical. He said Myriad basically, they just went in and sort of snipped DNA and tried to call that something new that's more akin to just cutting a branch off the tree and trying to call that something new.
Right, so at this point, which way do you think they'll decide?
I think it's hard to say. It really could go either way. Investors will have to stay tuned to the summer to find out. But the impact of this will be wide-reaching. It won't just be Myriad Genetics or other biotech companies. You take a look at Monsanto, which patents seeds, basically, that they've genetically modified. Amyris, which designs microbes for biofuels. This could be really a wide-ranging decision.
Okay, our second headline of the week is a budget issue with Big Pharma.
Well, absolutely, Max. And it looks like President Barack Obama's budget bludgeons Big Pharma. Of the significant cuts that they're going to have, $390 billion, 40% come from Big Pharma, and $123 billion of which comes from changing how Big Pharma charges Medicare to more of a Medicaid system where they can only sell drugs to Medicaid at the lowest price they offer to private insurers. Medicare is it's really the largest buyer, so to have that impact, that's about a 23% reduction in the price they charge. And you take a look at Big Pharma's already pressured by the patent cliff, like Eli Lilly, AstraZeneca, even Pfizer after the loss of Lipitor. Being able to hit them really, right in the sweet spot like that, that's going to hurt in the coming quarters.
Well, are there any winners here?
Hospitals could be a winner. There's $500 million in basically benefits for treating the uninsured that were deemed redundant with this Medicaid expansion, but because states can opt out of expanding Medicaid, hospitals are now, banging the drum to get this reinstated. It was going away for 2014. HCA, HMA, they really want this back because if they're operating in a state that doesn't expand Medicaid, they'll still be treating uninsured Americans potentially. President Obama doesn't look to do away with this completely, but it looks like they're delaying those cuts for at least a year in the budget. But remember, this budget isn't law, so you shouldn't invest definitely on it. But it sort of does give you an idea. It gives you a definite window on how the administration is thinking.
Right.
So, Max, that wraps up headlines. Let's move into our next segment, Cutting Edge. Now, first, you have science that Alkermes investors need to know?
That's right. So Alkermes recently came out with news regarding its depression drug. Now, major depressive disorder is a very serious problem. It afflicts about 16 million people a year in the United States, and there are a lot of common drugs that are already used for it, like Prozac. But these medications, they're called serotonin reuptake inhibitors, and what that basically means is that the drugs block the reabsorption of a hormone called serotonin, and that results in a change in your mood. Problem is that they don't work for all patients. So Alkermes is developing a new drug that treats depression in a totally different way. It targets a different biochemical pathway. It actually targets a receptor called the opioid receptor. If you think that sounds a lot like opium, there's a reason for that. It turns out that the opioid receptor binds drugs that are called opiates. Stuff like morphine, which of course is a very powerful painkiller but has really serious addictive side effects. So in this case, Alkermes' drug activates the opioid receptor and it helps treat depression, but it doesn't have these negative side effects. Now looking at the stock, shares are up about 30% in the last 5 days after it released some promising phase 2 data. And I'm looking forward to digging more into the clinical results when they release it next month at a conference. But investors, remember that we still need to see the numbers and the drug still has to go through phase 3 trials. So don't be too optimistic yet, but keep your eye on this one.
Excellent, Max. You know, the company does have some success as well. They have a lot of royalty agreements with their extended release technology as well.
Right, and they have another drug that's coming up through the pipeline.
So definitely an exciting company to keep an eye on. So moving on to the next cutting edge segment, you're going to talk about serpentine receptors and pharma innovation.
That's right. So we were just talking about the serotonin and opioid receptors in our previous segment. Both of these are actually called G-protein coupled receptors, or GPCRs. Now, the really cool thing about these proteins is that they kind of look like snakes on a molecular level because they wind up and down through the membrane. For example, let's look at a crystal structure just to illustrate that. So 40% of all drugs that are prescribed actually target a GPCR. And if you're looking for examples, all the depression drugs that we talked about, like I mentioned, and even Arena Pharmaceuticals' obesity drug Belviq targets a GPCR. Now, this is for this targets the serotonin 2C receptor, and it helps signal to your brain that you're full and you don't want to eat anymore. Now, why should investors actually care about this protein? Well, there's still around 150 GPCRs in the body that aren't very well understood. And scientists could unlock the mysteries of more diseases if they do understand them better. So there's still a lot of opportunity here. And actually, last year, the Nobel Prize was awarded to scientists who developed a technique to crystallize these GPCRs. That basically means you can have a molecular picture of how it looks, and it can help scientists develop new drugs that target it. So that's all the science we have this week, David. Let's move on to some of our movers and shakers.
I'd like to dedicate this movers and shakers segment. Usually we talk about pops and drops, but to earnings season, because we're starting to get the early returns in, Max, and they're definitely a mixed bag so far. I mean, we saw hospitals, HMA and HCA preview their earnings. We saw admissions fall, outpatient services fall as well. And really that's been reflected. You take a look at Johnson & Johnson, a great bellwether sort of for the whole healthcare industry. Its medical device and diagnostic segment, it did grow 10%, but the street was looking for about 16% growth because of that Synthes acquisition. So when you dig in, it was actually a pretty disappointing quarter for that part of their business. Their pharma segment, however, was still doing great. It really is helping drive the company forward. And, you know, you take a look at Amgen, which, just basically previewed and or reported, and they're doing, they had a solid quarter as well, and, they have a strong pipeline. And I think when you look at these more pure play companies, they're a little more resistant to obviously what's happening overall economically.
Right.
And the pipeline is really what drives their value going forward.
Right, and actually going back to Johnson & Johnson, looking beyond this quarter, they recently had a new diabetes drug approved. So we're probably going to see more benefits in their pharma segment coming up.
Yep. And I could even see it, eventually passing. It's their second biggest segment, but it's basically neck and neck with medical devices. I could definitely see it surpassing that in the coming years. Let's take a look at United Health, though, right, which is really the bellwether. It's the largest traded publicly traded insurer.
And it's one that investors are closely watching because of Obamacare.
Absolutely, and Obamacare is definitely having an impact. Sequestration hurt as well. They had, a decent quarter, but really what spooked everyone is they cut guidance for 2013 and below the low end of their range, and they're very concerned about 2014. They wouldn't offer any guidance for that. They're really concerned. We've filmed about the Medicare Advantage cuts going from basically negative 8% to closer to negative 4%. They basically see that as going from Armageddon to just disaster, but still not great. And they mentioned insurance exchanges. I know there's a lot of concerns over that. They're going to sort of dip their toe into that slowly to see what develops. Healthcare overall, though, Max, has had a huge run since the beginning of last year, and I think we are starting to see some real issues crop up. I think investors should tread carefully. But while they're treading carefully here, why don't you give them a name they should be excited about? What is one stock that needs to be on their radars?
Well, one stock I'm watching right now is Albany Medical Research. Now, I'm from upstate New York, but I have to say I'm not biased. So, it has a lot of moving parts for a small company. It's mainly a contract research organization, but it's also trying to profit from Big Pharma outsourcing some of their R&D projects. It also gets royalties from Sanofi's drug Allegra. I know last week on the show we talked about allergies, so this is a very apt drug to talk about right now. It also makes API, so there are a lot of things going on here. And the stock is up more than 200% in the last 12 months.
Well, is it too late to jump on, or do you think there's still a lot more growth going forward?
That's the question. That's why I'm watching it right now and I'm not investing in it. So I still have to see what will happen next quarter. It'll be reporting the first week of May, and that's something I'll be closely watching, mostly to see if it beats estimates. Second thing I'm watching is contract revenue. So it was up 50% last quarter, but they've said in the past that this has been soft. There seems to be some lower demand from big pharma. If it's picking up, that could be a great sign going forward. And the third is the pipeline. So even though it does a lot of work, contractor work for big pharma companies, it's also developing some of its own drugs, something I need to familiarize myself with first before I decide whether or not I invest.
Well, it sounds like an exciting name there, Albany Molecular Research.
Yep.
Thanks for watching, everyone. Stay tuned for next week's healthcare show, and make sure to check back to Fool.com for all the healthcare news you could ever want. Thanks for watching, and Fool on.